Imagine a child who refuses to follow rules, argues with adults over the smallest issues, and seems to deliberately annoy others. Now picture another child who bullies peers, destroys property, and has no remorse for their actions. While all children misbehave at times, some display patterns of persistent defiance, aggression, and antisocial behavior that go beyond typical childhood disobedience. These behaviors often fall under two recognized disorders: oppositional defiant disorder and conduct disorder. ODD is characterized by a pattern of angry, irritable mood, argumentative behavior, and vindictiveness, lasting at least 6 months. According to the American Psychiatric Association, about 3 to 5% of children meet the criteria for ODD, with boys being diagnosed more often than girls. Unlike occasional defiance, ODD involves chronic hostility, frequent arguments, and a refusal to comply with authority figures, whether parents, teachers, or other adults. The child may blame others for their mistakes, hold grudges, and be easily annoyed. Historically, defiant behavior in children was often seen as simple bad behavior or a result of poor parenting. However, research shows that biological and environmental factors play a significant role. Brain imaging studies suggest that children with ODD may have differences in their amygdala, which regulates emotions, and the prefrontal cortex, which controls impulse regulation and decision-making. There is also evidence of lower levels of serotonin and dopamine, neurotransmitters that affect mood and impulse control. One of the most famous cases that shed light on childhood defiance was that of the defiant child, a case study published in the 1990s. The child in question frequently lashed out at teachers, refused to obey simple instructions, and had explosive anger episodes at home. When examined by psychologists, he met the full criteria for ODD. However, instead of focusing solely on punishment, behavioral therapy was introduced, and over time, the child learned self-regulation skills, improving his relationships with adults. This case emphasized that ODD is not just about misbehavior. It is a disorder that requires intervention. Now, if ODD is persistent defiance, conduct disorder is a more severe and troubling pattern of behavior. Children with CD violate societal norms and the rights of others, often displaying aggression, deception, theft, property destruction, and serious rule violations. Unlike ODD, where the child argues but still has a sense of remorse, children with CD often show little guilt or empathy for their actions. According to the National Institute of Mental Health, CD affects about 4% of children and adolescents, with a higher prevalence in boys. If left untreated, around 40% of children with CD go on to develop antisocial personality disorder in adulthood, making early intervention critical. Research shows that children with CD often exhibit early warning signs, such as hurting animals, setting fires, or engaging in manipulative behaviors at a young age. A striking example of CD is found in the case of the callous teen, a widely discussed study where a 14-year-old boy displayed no remorse for harming classmates, repeatedly engaged in vandalism, and lied compulsively to avoid consequences. When examined, he was found to have reduced activity in the brain's orbitofrontal cortex, the area responsible for impulse control and decision-making. Studies like this have fueled the debate on whether CD is a result of genetics, upbringing, or a combination of both. Research points to several risk factors for both ODD and CD, including biological factors. Studies on twins suggest that genetic influences account for 40–60% of aggressive and defiant behaviors. Environmental factors. Exposure to abuse, neglect, family dysfunction, and inconsistent discipline is strongly linked to ODD and CD. Neuropsychological factors. Studies show that children with CD and ODD often have deficits in executive functioning, leading to poor impulse control and difficulty in understanding consequences. When it comes to treatment, early intervention is key. One of the most effective therapies is parent management training, where caregivers learn strategies to reinforce positive behavior while discouraging aggression and defiance. Studies show that PMT reduces ODD symptoms in up to 75% of cases when applied consistently. For children with CD, treatment is more complex. Multisystemic therapy, which involves family counseling, school interventions, and social skills training, has shown promising results. However, if CD progresses without intervention, juvenile delinquency and legal troubles become a significant concern. Studies suggest that over 50% of incarcerated youth have undiagnosed or untreated conduct disorder. One of the biggest misconceptions about ODD and CD is that children grow out of it. While some behaviors may diminish with age, research shows that early defiance can be a predictor of future antisocial behaviors if left untreated. Another misconception is that ODD and CD are just the result of bad parenting. While inconsistent discipline can contribute, these disorders have strong biological and psychological underpinnings, meaning that professional intervention is often necessary. A powerful example of how intervention can change a child's trajectory is the case of James Fallon, a neuroscientist who discovered that his own brain scans matched those of individuals with psychopathic traits. However, because he was raised in a nurturing environment, he never developed antisocial behaviors. This highlights the critical role of environment in shaping behavior, even when there is a biological predisposition. Ultimately, children with ODD and CD are not bad kids. They are children struggling with serious emotional and behavioral challenges. With understanding, structured intervention, and early support, many of them can develop healthier ways to navigate the world.